Okay, wow. Okay, hello everybody. Welcome to the January SWOG webinar. Today we are joined by Matilda van der Bosch and William Bird. We dreamed up this webinar late last year, and I was cheeky enough to ask Matilda, and she was kind enough to oblige and bring William into it as well. So I think we all have a hunch that being outside is good for us in a physical way and a mental way. But today we're going to have an evidence-based look at why that is true and why being outside is very good for us. So without me going on too much, I'll pass over to William and Matilda and take it away, please. Thank you.
Thank you very much, Sarah, for the kind introduction. Sorry, William, you can go back to the first slide, actually.
Apologies.
No worries at all. Yes, as Sarah said, she invited me just to talk about the evidence, the research around nature and health. That is what I've been doing for quite a few years. And when Sarah asked me, I thought, okay, I need to bring my friend and colleague William Bird on as well, because we have a very similar background and have similar perceptions of these ideas. And I think the background why we are doing the kind of work we're doing is very similar between the two of us. So I've been doing research currently at the Barcelona Institute for Global Health in Spain, and also as a senior researcher at the European Forest Institute, a biocides facility in Rome, Italy. I say this just to sort of showcase this interdisciplinary world where I see that we can do the most between the health and the forest institutes, also from disciplinary work point of view. Now, next slide, please. So did you know this is a health impact assessment study that cities in Europe could prevent up to 43,000 deaths each year. This is a stunning number, 43,000 deaths annually, if the cities lived up to the WHO recommendations of access to urban green spaces. So people need access to urban green spaces to be healthy. That is at least what the WHO recommendation says. And for me, it's interesting that the Health Organization is so really recognizes the value, the impact of green spaces to the extent that it actually has it as a recommendation, as a guideline for cities to live up to. And it's from these impact assessments, this one is done by the institute where I'm currently working, they find that we can actually save a number of lives on that. On the other hand, only 60% of the population, 60% of the population does not have this access. So this is something we need to work together with urban planners and governments and so on, and policymakers, to be able to actually live up to these goals. But why does the health organization, the World Health Organization, bother about forests and trees and green spaces? There's a lot to say about that, and you can go on to the next slide, William. So this is where I used to work at the University Hospital of Lund in Sweden as a doctor. I worked as a radiologist by the time. And as you see, it's not a very beautiful building, and it's not the most healthy place. I was working there, so it was okay, I guess. But I was thinking about the patients. I think it's not really improving sick people's health to come to a place like this. And this is what I started recognizing more and more as I worked there. This thing that, okay, this is not the sort of environment I would like to dwell in if I were ill. And even more, if I... when I was looking at the kind of patients I was meeting, and this is, I think, what William discovered as well, they were suffering a lot from lifestyle-related diseases, environmentally related diseases, non-communicable chronic disorders, which are much better to prevent, rather to have people coming to this awful hospital. So much can be done before. Next slide, please. So that is when I started reading up, or I found out actually from some contacts and from reading in the daily news about studies that showed that nature per se can have a positive impact on health. And this is a landmark study that was published by Roger Ulrich in 1984 in the scientific journal Science, where he looked at patients who were recovering after gallbladder surgery. And he found that the patients who were recovering in rooms with views of a green park, they used much less of the strong analgesics. They didn't have so much pain as those patients that were recovering in rooms where they had just views over a brick wall. So just this view of green actually made them recover with less pain and recovered faster, and they went out to the hospital faster compared to those patients that were staying in the rooms with view over a brick wall. Next slide, please. So I decided to take this seriously from me personally. I changed my career and left this ugly hospital. I went to the beautiful campus of the Swedish University of Agricultural Sciences in Alnarp, where we did not, well, yeah, I would actually think this is a healthier environment. Personally, I felt happy every day to go there, and I think it's a more welcoming and nice environment for patients as well. It would be, and that is where I pursued my career in landscape planning. So I got a PhD in landscape planning and public health, and I never ever regretted it. And I think this is. It says quite a lot, I think, about these interactions, because I felt better, and I think we can do much more by preventing disease and promoting health through nature. Next slide. Eventually, I moved to another beautiful place, the University of British Columbia in Vancouver, another nice natural area to live in. Next slide. And now I'm, as I said, at the Barcelona Institute for Global Health. It's like a blue space, also beautiful enough. And then next slide, the European Forest Institute in Rome. Okay, so next slide, William, thank you. As I mentioned already, the kind of diseases that we encounter today that are challenging the world have been changing over time. This is from the Global Burden of Disease scenario studies, also supported by the WHO. And you see in 2004, the major burden was related to infectious diseases. But already as we move on, you can click, William, next. You can see that in 2013, I think we're already there, mental illness like depression is the most common illness across the world. This is globally we're talking. And then other chronic diseases like heart diseases and road traffic accidents, clearly related to the urban living, to the kind of environments we are living in, and stroke and chronic respiratory diseases and so on. What I'm trying to say here is that these diseases are very difficult to treat. There are antidepressants, for example, but we know that there's so much more that can be done by preventing these diseases before you actually need hospital or health care for it. I think 80% of the non-communicable diseases which these belong to can be prevented through other socio-environmental actions and initiatives. Next slide. Yes, so how do we do to prevent these diseases? In order to do that, we need to know a little bit about the risk factors. And the major risk factors today for the diseases that we suffer from are stress, in particular chronic stress. Physical inactivity, William knows a lot about this, I think he will talk about it. Loneliness is a major risk factor, and ironically, paradoxically, loneliness and social isolation is more common in cities compared to the countryside. And we know that there are some studies showing that loneliness is as dangerous to your health as smoking almost 15 cigarettes per day. So this is really something tangible. And you see, this is nothing we can do anything about as a doctor. You cannot treat loneliness in a hospital. Then, of course, we had the big contextual factors like climate change, environmental pollution, and urbanization. Nothing we can do about that in the hospital, right? Next slide. But what can we do? We can work on many different angles and perspectives to address these risk factors. I happen to be interested in addressing it through environmental initiative, and in particular the natural environments, and that has been our main interest. It's not a silver bullet solution, of course. We need to work across sectors and disciplines and so on. But for me, nature and the natural environment has been, first of all, it fascinates me personally. I'm very fond of nature myself. I love being out in nature. And but also for me, it brings it together in a way. So, okay, so if we can bring the awareness that nature is important for human health, we really can bring the awareness that we need to preserve the environments, we need to protect the biodiversity of our environments as well. So we can get this into this holistic thinking of the healthy ecosystems which promote healthy human beings. Okay, having said that, nature reduces risk factors. And what do we know about that, William? Yes, thank you. So I mentioned physical activity, loneliness, and stress as major risk factors. And a number of studies have demonstrated by now that we know that people in green neighborhoods tend to be more physically active. There is a stronger social capital in these areas. And we also know that nature exposure, various ways of nature exposure reduces stress. Okay, I say this, I cannot go through all of the studies, but we have a lot of evidence for this. We also know if we're thinking about it from an ecosystem services perspective, we talk about the regulating ecosystem services, which address these contextual factors like climate change and environmental pollution, for example. Urban trees are very important for reducing the urban heat island impact, which then in turn reduces heat-related morbidity and mortality, something that we will see becoming an increasing issue as global warming and climate change continues. Also, studies show that the urban trees can reduce air pollution to some extent. And I put on the top here, I put biodiversity, because without biodiversity, we don't have any healthy ecosystems, and then we don't get these services and these benefits. Okay, next, click, William. Yes, I just listed here, these are just examples of the number of health outcomes. A lot of studies, we have both experimental studies, but also a lot of so-called epidemiological studies, population-based studies, cohorts, where we bring a lot of big data together with natural exposure data and show that green neighborhoods have a reduced risk of depression, cardiovascular diseases, stroke, diabetes, etc. All those issues that I showed you before are at the top of the global burden of disease. And the nice thing with nature is that it also increases, it's also this sort of salutogenic environment, which is promoting health. It increases happiness, it makes children more attentive, they perform better in school, they sleep better, memory capacity and so on increase. So there's a lot of benefits that have been demonstrated in the scientific literature. Next slide. Yeah, as I said, I will not be able to go through all of these studies. I talked to a colleague the other week from WHO, actually, that we have been working on this together. And he said, like, when we started working together in 2015, I think, some 10 years ago, we started working together, and he said, yeah, those were the days, and you could be on top of all the literature. Actually, you could know every new article that came out, but now it's impossible. It's like thousands of new articles all the time. So the evidence is really, really increasing, which is great. It helps us to tell politicians and planners and so on, okay, we have good evidence, for example, for this, that people are more physically active in green neighborhoods. This is an example from a study by Thomas Bird and his colleagues in Australia. It's a sample of more than 200,000 participants. And they looked at the level of physical activity. And basically what you can see from the graph is that even when controlling for income and education, age and gender, the chance of being physically active is almost 25% higher in the most green areas compared to those where there is hardly any green at all. Next slide. Similar, just an example by Andrei Egorov and his colleagues. They looked at a biomarker composite called allostatic load. It's measuring different biophysical indicators like stress hormones and in a composite to assess level of chronic stress, and they found similar. So what you see, the different bars are just different versions of this allostatic load index, so it's not super important. Basically what the image tells you, what the graph tells you, is that yes, there is a significantly reduced risk of having this chronic stress if you live in areas where there is more green space. Next slide. Yeah, and I can't resist to show this one because I think it's a beautiful, it's from 2008, but it was also, I would say, a landmark study. It was published in The Lancet by Richard Mitchell and Popham. And it's, I think it's the sample size is some 40 million from UK. And the interesting thing with this one is that they looked at the British population and distributed them, categorized them per income. And we know this is one of the things we need to address if we want to improve health, is to address socioeconomic inequalities. There's a huge gap between people in the highest income group and those in the lowest income group. And there's no biological reason for this, right? There's no biological reason why people with low income and poor education should have poor health, but this is a fact, and this is something we need to address from a societal perspective. The very fascinating thing with this study is that they looked at these groups, they grouped them in 5 categories of people who had the least up to the most exposure or access to green space. And as you can see from the graph, the gap between those at the highest and the lowest income, the difference in their health, in their this is the indicator of mortality, life expectancy. That gap decreases significantly. So there's something with this being in green space, having access to green space, that seems to buffer the socioeconomic related inequalities in health. I find it very, very interesting because it's a hard issue to address, right? How do we address socioeconomic inequalities? And if we can have this kind of evidence based on huge data, large data, this is a good argument for providing green spaces to address this big issue. Next slide. Yeah, this is, we published recently a systematic review where we looked at the cost benefits. This is something we often get questions about. So, okay, so this is good. Is it good with green spaces? Yes, it is, and we know that it can also be a cost efficient alternative. From this systematic review, where we looked at previous studies, we found that yes, it seems like greener areas, there's less prescriptions, less medications needed there. Possibly because we address the risk factors instead, and the costs for healthcare are lower as well. Next slide. Yeah, I just wanted to, it's hard these days to give a talk without mentioning COVID-19. And I think most of us are aware of the tragic death toll it took, but maybe less well known is the mental health toll it took as well. The WHO estimates that around 25% increase in the prevalence of anxiety and depression worldwide as a consequence of the pandemic itself and related lockdown. Next slide. So we wanted to look at Catalonia in Spain, where I'm currently looking, and see, you know, Spain was one of the countries where the confinement regulations were really, really strict. So people really couldn't go outside their homes. So therefore, we were interested if people in a dense city like Barcelona, if the lack of green spaces was actually an additional risk factor for developing mental illness. Next slide. And yes, indeed, we found that the risk of severe clinical depression, this is what we used in our surveys, an indicator of this risk increased with the relative risk was almost 2.5 times higher if you have the complete lack of native view from home. And I think this was true for 15% of the population in this group. And you see it's on par with living alone. So it's a major risk factor. There's something like just viewing green, like from one of the first slide I showed you, that the views of green is really important for us as human beings. If we can't go out, at least to view it has an importance. Next slide. Yeah, this is because it's important as well. Sometimes we think about this, okay, what is this? Okay, viewing green, why is that so important? So I wanted to bring up this study as well by Greg Bratman and his colleagues in Stanford. They published it in the PNAS in 2015, where they looked at the particular area of the prefrontal cortex of our brain, where we have sort of, that is where we have our thinking and emotions and so on. And this, they looked at the particular area which is active when we do something that is called rumination, which is this negative thought spirals. People who are depressed tend to have very, very negative thoughts about themselves and about life and so on. And so they looked at people who and tested them with this brain imaging technique, where they could see that this area was active. And then it was a randomized controlled trial. So one part of the group, I think there was like say 35 participants, went to walk in a woodland, and one went for a walk in a built-up area. And they found that after this walk, those that went to this nature woodland walk, they had a significant decrease in the activation of this rumination, this depressive area of the brain, while they saw no such effect in the urban walking group, which is fascinating, right? It's like really showing, okay, this nature has an impact on the very structure and function of our brain, which is, I find it fascinating, at least. Okay, next slide. Yeah, just to say something about the studies I've been doing myself, and we looked at, when I worked in UBC in Vancouver, I did a lot of studies on children, on childhood development, neurodevelopment, and ADHD, for example, and we looked at combined exposures. So in this study, we found that the children in Metro Vancouver who had small amounts of green spaces in their living environments, while at the same time high levels of air pollution, they were at a 62% higher risk of developing ADHD. While on the other hand, if you lived in the optimal environment with a lot of green, the risk of developing this was 50% lower, and it was almost 40,000 children we looked at. You can click, William, thanks. It was my PhD student, Bayran Ducci. You can keep on clicking. William, you can just keep on going to next slide. This was just to show that it got some. Yes, thank you. Again, what is this for? What is it with nature? One of the theories, which I think is very interesting personally, is because also it relates to biodiversity. So there is a theory initially suggested by Graham Rook, the biodiversity hypothesis, which suggests that the exposure to biodiverse to microorganisms in soil, in nature, in woodlands, for example, boosts an immune system by going through being exposed to these microorganisms. The gut microbiome, the microbiome of our own guts, gets boosted with the kind of bacteria and microorganisms that we need to develop our immune system, and that in turn prevents the development of immune system related disorders like allergy and IBD, eczema, and so on. And there are a few studies that have demonstrated exactly this thing in experimental studies. They expose children to biodiverse sand material, and they find immediate impact on the gut microbiome in a healthy manner. Maria Roslund, for example, and other colleagues in Finland. Yeah, I can't go to, I find it very, I hope there will be more questions on this. I will take next slides and we can discuss it further. Just to talk to, because this is such a nice natural experiment on the same kind of thinking. So this is from Karelia, which before World War II was a very homogeneous region. The population was very homogeneous. They lived in the same way, same kind of environment, same cultural traditions, and so on. And they had the same kind of disease scenario, no allergies, basically. After World War II, the Finnish side, thank you, became industrialized, while the Russian side did not. And look what happened. On the Finnish side, you see, like immediately after, you see a slight increase and then almost an exponential increase in the allergies against both birch and cat. So it's something with the, I don't know, you cannot say much more about these graphs, than there's something that changes between these two areas, and whether it's industrialization, whether it's hygiene, whether it's urbanization, whatever it is, we cannot perfectly say from these graphs. We need another kind of studies to pinpoint exactly what it is. But something here confirms what we see in the rest of the world, in the westernized world, where we see very high levels of immune system related disorders that we don't have in other parts of the world, in the global south, for example. And allergies, I think the first time a doctor diagnosed allergy was in the 1870s. Before that, it didn't exist. It's something that has come with modern time. Next, you can click, William. Yeah, this was just that they found similar things then. So this were the birch and cat allergy, and they found the same patterns for asthma, hay fever, and atopic eczema. I think that should be it. Yeah, this was just, you can keep on clicking. I'm running over time. Yeah, this is with just my childhood environments where I was exposed to soil and woodlands. Yes, so this was just to say that, okay, we need to have our children outdoors. We need to have them exposed. So it's great that you have them, that you have woodlands. When Sarah talked about her son being out there, which is lovely, of course, because this study is I don't know what to call it, fascinating or intriguing. The study of British school children revealing that kids between 4 and 11 are more than twice as good at identifying characters from Pokemon than common organisms such as a beetle or a rabbit. Okay. Thank you. Over to you, William. I think William will be great in showing you how these things can be brought into practice. Thank you.
Thank you, Matilda.
Thanks very much, Matilda. And let me just get my video there. Good. And I think, in fact, I will not name drop, but I was just giving evidence at a select committee this morning to the planning types of people about the urban environment and children. And giving some of the information that Matilda's just presented to you now was completely new to most of the MPs there. And it's quite a shock that actually this research has been going on. That first one, Matilda said 1984 from Roger Ulrich. And I remember that one very vividly being our first thing. And despite vast amounts of information, they're still not, didn't get it, didn't believe it. And the real worry is that those children who get the ill health from the mental health, and you saw from the brain side of things, that sets them off for the rest of their life at a real disadvantage. So they can't really catch up. You can if you have a really kind of healthy life and you've got lots of support around you and things turn out okay. But really what we're doing is for children, particularly if they start off without nature, then you are going to get into real trouble. So I'm a GP, and like Matilda, started off as very much full-time being in medicine. I've gone off a slightly different track, and I set up I worked at Natural England, I worked at the Met Office, and then I set up Intelligent Health to really try and engage young people and young families into the local environment and to get communities. We do it through a game called Beat the Street, which I won't mention, but basically the idea is that a lot of people, particularly in deprived environments, live in areas where they're next door to woodland or next door to parks or next door to some really lovely places, but they don't go in there. And there are lots of reasons why they don't. It's often a bit of perception of fear. They were never taught when they were children because they have a second generation who haven't gone in there, so they can't see the point of going in there. It may be they believe it belongs to someone else, or it could just be dangerous. It could just be a feel that they're alcoholics and antisocial behavior going on there. So that's what we feel we try and do. And what's developed in the time that I've been interested in this in the UK is that we've now got nature on prescription officially sanctioned and paid for. And in fact, got the Treasury actually put some money in this. And what it's doing is looking at all the benefits that Matilda's just gone through and all the issues there and saying, well, if someone's ill and they've got mental health problems or they're lonely or they've got something else, why don't we connect them to some community event that's teaching them about nature? And instead of giving them drugs or operating on them or sending them to a psychologist or a psychiatrist or a counselor, why don't we just connect them to nature with others? And it works. A lot more research is coming through. It's still early days and still a lot more to learn of how to do it for certain people and certain groups. But actually to get someone now, and once they got used to it, because obviously most people go to a doctor expecting a tablet or a pill. So when you tell, we'll go for a walk in the woods, doesn't really kind of sometimes relate to some people, but it is now with the evidence, people are getting used to it. And it's part of a bigger development of social prescribing, which has been funded by the Department of Health for the next 5 years. They put £1 billion into it to train up 5,000 link workers. And basically the GP will then talk to the patient and say, look, we can start you on some medication, but why don't we try social prescribing? Why don't we link you to this group of people here or to that event there and see if that works best? And then come back, because there are no side effects there, but obviously there are side effects with the medication. And I think we're starting to realize that most antidepressants have got very minimal impact. And you've heard of placebo. In some cases, the placebo, where there's absolutely nothing in the tablet apart from a bit of sugar, is as good as the antidepressant, and yet the antidepressants got side effects, withdrawal, and other things. So there are different ways that we can do a social prescribing. There's the GP just signposts someone to a nature activity, and that's what it's always been. When I first started, we set up groups like green gyms and health walks to try and get people outdoors so that they could actually connect to their community. So if someone had high blood pressure or mild depression, or they had some cardiovascular disease or asthma or respiratory, or perhaps just had learning disabilities and just needed to be out, we'd refer them to what was available. And that signposting went to direct, where you could actually make a direct referral. So you write a note to say, I want this person to go over there. And sometimes the money followed as well. But what's happened now is number 3, where as a GP or a nurse, you can refer to a link worker who sits in a practice or a group of practices, and they then decide where that person is best fitted in the community. Should they go to a health walk, a green gym, a conservation, forest bathing, what activities are going on which actually are local to that person, are going to suit them. And then we get this link worker hub, which is now groups of organizations and volunteers who sit there, and we can then refer people into that. And there are different groups of patients. So you've got the specialist ones who are really complex, and they're the ones that, as if you're owning green space or you're owning a community group, you probably wouldn't send those people to there. They need someone who's got really a good understanding of how to deal with that. You've got the targeted ones where someone has got a problem, but they don't need a huge amount of extra care. They certainly don't need anyone medical or professional. They can actually be someone who can just look after them as a leader. And then the universal is where people don't even need anyone. They can just go off and do referrals. And so increasingly what we're finding, and with the NHS promoting this and putting that big amount of money in, is that we're trying to get everybody to look at the benefits of the green space because of all the evidence it shows. We're then trying to say those people who've got more higher need, who've got a clinical condition like depression or asthma or heart disease, then we'll have someone who's semi-trained to be able to help them develop and work through the green space and whatever that activity is. And then obviously the ones at the top end are ones who are kind of highly trained, and that's a really small number. And there are different things. This is one I set up the Green Gym right back in 1996. It's still going. TCV organise it, and there are groups all around the country. And what they basically do is that the GP referred to a link worker will say, look, there's a green gym there, why didn't you go there? And what we're finding, the evidence from here, there's certainly a real positivity and people feel well, but we're also knowing that blood pressure starts to change and drop down. We start to say their depression score starts to improve, the anxiety score starts to improve. And you can even start to look at more blood measures, not proven here in Green Gym, but certainly in any conservation work. When you're connected to nature and you're doing physical activity and you're connected to a group, you've got the 3 big aspects on on health. And as Matilda said, being lonely is the equivalent of smoking 15 cigarettes a day. So it's not just being in nature and having that connection, which of course we already know does make a difference. It's that group, that community that you join in to do a task, and the activity and the focus that's delivered. Horticultural therapy is the other one that's been very, very popular, and that's increasing. Again, this doesn't take up so much energy and effort. So someone who's even more frail, older, elderly, has got perhaps some joint problems, rheumatoid arthritis, etc., this would be far more suitable. And it's that hands in the soil, that connection really makes a massive difference to someone when they're dealing with nature. So it's not just watching it, it's actually putting your hand and delivering something from it and watching things grow. And then hopefully, as all woodland owners, you've all heard of forest bathing, starting in Japan, and I can never remember what the name is, but one day. I'm sure Matilda did, because she speaks about 50 languages. So,
No,
but
Shinrin Yoko.
I thought you were going to say it. And it's quite formalized in what you do, but in essence, it's about being out there in the forest and just being still and just being absorbing all the smells, the sounds, the sights, how the feeling is. And this has had a bit more research showing how the blood pressure drops and the stress is very similar to most of the other things that we've done, but they have just published a report on the benefits of forest bathing. And that can be referred from that link worker. So can health walks as well. And this is just literally walking. A group of people will walk. Again, something I was really interested in, got going back in the 90s. But there are lots of them now of different groups and different people. These are the Ramblers one, which is the one that used to be called health walks, and now they're called wellbeing walks. But lots of communities do it. And the evidence about just going for a walk is so strong. It's so simple. We always kind of talk saying, oh, that was like a walk in the park, as a derogatory way of saying that was really, really easy. But actually the health benefits of just a walk in the park are really quite stunning. And having that camaraderie, that group, and there's definite evidence that when you're in green space, you act in a more pro-social way. In other words, you actually let your guard down a bit and you're more open to other people, probably because the stress levels in the ventral vagus nerve is being affected. But people can talk to each other. And if you can't talk and feeling quite bad, then just silence is accepted when you're going for a walk, rather than sitting in a room where silence becomes really uncomfortable. So this is a really great way, so simple, to try and get health benefits. And a recent review on outdoor activities saying that actually just 8 to 12 weeks can actually make a massive difference for long-term follow-up. And about 20 to 90 minutes at a time actually helps improving outcomes in adults and mental health. So we're starting to see the evidence building up that not only do we know that nature is hugely important for our health, which I think now we don't need to keep on researching except for perhaps adding new nuances to it. But what we do need now is the research to show that these interventions are not only good for the short term, but they actually have a long-term effect, that that person goes on and changes their lifestyle. Thank you very much, Sarah. That's all I've got. And so I think there was nothing more on that.
Oh, thank you so much, William. That's really interesting. I think the bit about the lower economic, the socioeconomic scale, and how people at the lower end are they suffer more. I think that makes me think of, you know, social housing, where they put them in like tiny little houses with a tiny little postage stamp garden all upon top of each other, or in like a high-rise flats. It's true, isn't it? They do that. It's like, yeah. We have some questions, and if anybody has any questions and they'd like to get them typing now, we'll start working our way through. Let's see what we've got. So Sue says that I think this was in reference to spending money to green areas. That's because there's no political will. So Sue has asked, would it be possible to share the presentation slides? Yes, I think that would be fine. Also, don't forget we're recording this, and I will also upload this to the YouTube, and I'll share that around too. So Maeve says she's a gardener and an ecology student and has suffered from depression, particularly related to climate change, anxiety, and biodiversity loss, grief. There is a risk factor for nature connection, and she wonders if hope antidepressants aren't being demonized. I don't think that's what William was referring to.
No, I'll just say that people react differently, and there are some people have resistance to antidepressants, and they're the ones who've got inflammatory cause of their depression, and antidepressants don't work very well on those people, but nature does. So for some people, antidepressants can work, but when you add them all together, we're all so individual that some people respond very, very well, and without them they'd be really, but some people may just not get any benefit at all, and they're just getting the side effects. So what we're beginning to understand now is that one day we'll be able to understand from the genetics who's going to respond and who isn't. So I'm saying that for those people where it doesn't work, we know that nature and that connection can be a substitution, which would be really good. I'm certainly not saying it's not the right thing to take.
And I think, William, to back up what you're saying, I don't mind sharing from personal experience. I think antidepressants, they can take you so far. But I think any sort of like outdoorsness, and because I'm always in some sort of permanent state of training for a mediocre style triathlon. But I always think that can always help. It sort of like boost you along a bit more. So I think thank you for sharing and adding to that.
Yeah, I just wanted to add as well. I think this is, I totally agree with you. And I think it's important as well. Like I said, it's not a silver bullet solution. It's not like, okay, we give nature to everyone and everyone will be happy forever after. But it can be a complement. It can be something that we work as one strategy.
Thank you.
Together with others.
Ruth says, how can members of the public access these social prescribing initiatives? Like, is that something that one could suggest to their GP?
Yeah, so almost not every GP will have got it yet, but they're a little kind of group of GPs clustered together in something called a PCN, a primary care network. And those go up into a bigger group called the neighbourhood, and they go to a bigger group called the integrated care system. So every GP practice will belong to a PCN, and they've all been given money by the government to set up a link worker. So almost every practice should have one, or if they're not, they're getting one, because it is still being rolled out.
Okay, so I think the more people who ask, the more it will prompt it along in the right way. Oh yeah. Thankfully, we've got a forest bathing webinar that's coming up in April. I haven't started advertising it yet, but that's good. So that ties in nicely. Does the size of the green space matter, and whether there is diversity of shrubs and trees? Thinking of mini forests here. That's from Anthony.
That's a Matilda question.
You saw me lighting up to that one. Yeah, no, the size of the woodland of the matters, but I always say that depends on what outcome you're looking for. Okay, of course, if you're out, if you want to use the space, the forest to improve your physical activity, yes, it's better with a larger space. But like to just have this soothing spiritual effect with spiritual health is also important, right? To just look at one tree can be important. So it all depends on what health outcome you're thinking about. The biodiversity aspect that happens, as you might have noticed, I'm a little bit obsessed with that at the moment. That happens to all of us working with this. We find something that we start burning for. So I'm passionate about the biodiversity for exactly that reason. And I think that and then you can talk about biodiversity at various levels. So the species diversity, which I think has been related to like the aesthetic aspect. It seems like people perceive diverse tree species, and whether it's shrubs and grass and so on, and some sort of nice mixture, it's perceived as nicer. And then we have all this, the diversity of the microorganisms, which then has an impact on the immune system, which would talk for the impact, the importance of the biodiversity. We did some research. I did some research with my student in Metro Vancouver as well, where we looked at a few different health outcomes, and it seemed like actually what she found, or we found, was that the shrubs, like a little bit, not massive forest, not grass or anything, but like this little bit smaller kind of, yeah, shrub vegetation was particularly beneficial for mental well-being. But this was, this was one of these population-based studies. We had 40,000 participants or something looking at that. So it's combining of data, so we don't have any explanation for why that is so. That's something we can just speculate about. Yeah.
Making me think of in Japan, with their bonsai trees. They're tiny, but they bring a lot of like calmness. So
yeah, very, and that we have these harmonious patterns. Yeah.
So Joss asks, does one need planning permission to get involved with this if you have woodland? I guess this is a question for Mary. Mary's a resident knower of these sorts of things.
Sorry
to put you on the spot, Mrs. Cooper.
I think it would need looking at. I don't know actually whether Ruth might know any more. I think depending on what you were planning to do, you may need to seek permission for change of use.
Right.
Yeah, I don't know if anyone can hear me.
Yes, we can.
Oh, okay, great. Yes, planning permission. You're absolutely right, Mary, in regards to change of use. If you're looking to do something for more than 28 nights of the year, then you would probably need to get permission from the local authorities for a change of use. Something less frequently, then less likely, but it's always good to get guidance and belts and braces, make sure that you're not contravening any planning legislation, but certainly something less regularly. Normally you wouldn't need specific permissions in place from the local authorities. That's the sort of basic rule of thumb.
Thank you, Ruth. Okay, and I suppose that ties in, Andrew, with what we've just mentioned about how you would offer these sorts of schemes. I suppose you'd have to look into the legislation, but I think, yeah. So Dawn asks an interesting question. Any idea whether AI nature would work for those who are housebound?
Well, yeah, with I haven't seen AI tools, but we used in previous research, and other research has done it as well, using VR, like virtual reality nature, where you can, and I mean, it can go from just screens, views of digital nature, to actually being immersed in a VR environment. And yes, it works actually for stress recovery. It's fascinating. We found in the studies, and other studies have found as well, like real impact on the cortisol and other stress hormones and other biomarkers of stress in particular. Obviously, it doesn't necessarily help to make people more physically active, but I think these most research seem to indicate that yes, for stress recovery, it can be helpful. We lose out, of course, and it depends on the type of virtual reality, and maybe with AI tools, which I'm not an expert on, you can add these other sensory experiences, which I think is what we need, what you get in a woodland. You get the smell, you get the tactile experiences, you get the sounds of birds, and you don't necessarily get that in a VR or AI environment, but you can certainly get some benefits. And I think it's important, exactly like this, now I can't remember the name, person mentioned that it's, some people can't actually get outdoors, and then it can play a important role.
So I don't mind showing you. My friend is an interior designer, and I have green wallpaper because she told me that green is serene. So maybe that.
Look at that. Yeah. Sure, good. That's why you're so happy.
Maybe. Is there a process or organization for woodland owners to connect to if they want? Oh, that ties in with what other people have asked. I think, I'll tell you what, I think a lot of people are keen to get involved with it, and the social prescribing things. So Sue says it makes her think about the street trees that Sheffield Council chopped down to a lot of protest. So yeah, perhaps they should have been abreast of this research before they went pruning them all away.
It's incredible it's still happening.
Yeah. Is there a hub where, as a woodland owner, you can register your wood for outdoor wellbeing? Baz, that is a good question. Tell you what, it's something we can promote on our SWOG via the newsletter, though, and this and on our social media. So I'll put that on my to-do list. Okay, so Chris, I think this is quite a common issue. So Chris is saying that 4 years ago he gave up his headship as the pressure had turned to stress. I moved house and bought a woodland. I'm much healthier now, so I'm not surprised of the health benefits. I think a lot of teachers have left their teaching due to stress. So yeah, I think that's interesting aspect. Thank you. So Sam says that they used to work for the Department of Health and are still connected into the government political and policy world. What would be top of the public policy wish list to connect more people with nature in this way? Good question. Good proactive question.
One thing it's perhaps the simplest thing is that the government actually put across a 15-minute legislation. They were going to make it, but there was 15 minutes to green space, so they wanted every single person in the whole of the United Kingdom to be 15 minutes away of walking to green space, and it went through Parliament and it got through into the, and then I just heard in December this government have watered it down again, and it said it's an optional, and then it will probably fade away. But if we can keep that alive, and I know there are a lot of MPs trying to really, really keep that alive, that would mean that you've got people close to nature wherever they are, so we'd be able to increase it. So I think that's the simplest one. The other thing is to make sure that we continue to use the green social prescribing and social prescribing, because we don't know what will happen in governments. They're trying to cut money. It cost a lot of money for 5 years, £1 billion in healthcare. Money is a drop in the ocean for healthcare, but for other places a lot. And if the results don't come through and it doesn't get used, so I think keeping the pressure that that's so important is the other thing, and making sure the MPs recognise how important the green social prescribing is for their constituents will keep that pressure on. I think they're the two levers that one can use from government. But the 15-minute one, it's in there. It's in Natural England. It's in the Environment Plan. It's just it was going to go through legislation. Unfortunately, it's not now. But we can keep lobbying for that to keep government on their toes.
So Sam has already been Googling, and he's found that in Surrey, they've got lots of helpful links already. So it seems like some counties are ahead further than others.
Surrey's good. Yeah, Surrey's good.
Okay.
There are 8 pilots of green social prescribing, and we're just waiting for, and I do know actually, but I can't say, that Treasury were going to refund another 5 years of these pilots to get all the information we need. Surrey's one of them. So that's why Surrey's so really good on social prescribing. I can't for the life of you tell me where all the others. Bristol's another one. I do know there's one not in Liverpool, one in Manchester, and then I run out of places. I can't remember what all 8 were. But you can look at it online and see if your area's in it. And that's where a lot of the energy and research is going. So social prescribing is everywhere, but green social prescribing specifically being tested is in those 8 places. But green social prescribing is happening in other places as well. It's just not getting all the targeted evaluation.
Oh, this is good. I bet around Manchester, I bet they send people to Delamere Forest. It's really beautiful around there. So Sam's also found a blog, if anybody would like to have a look at that. This inspired Sue to do some sessions in her wood, and Lynn would like to say that she feels that having her woodland has really helped her mental well-being, instant stress relief, and the grandsons have been going there since the oldest was 4 and now he's 9, and he's on the school eco council, so it would seem to support the evidence on the slideshow. That's a nice positive addition. Thank you, Lynn.
That's nice to hear.
Yeah, that's good. Getting the little ones, bringing it forward. Yeah, really good. Well, I think that brings us to the end of our questions. If anybody has anything else, if you'd like to say it verbally. And if not, I think that brings us to our end. So if anybody has any questions that they think of after we've all left the webinar, please send them to me at sarah@swog.org.uk, and I can pass them on to Matilda and William, and I'm sure they'll be happy to oblige. And I think I speak on behalf of all of us when I say thank you so much for taking time out of your busy working days to come and share your time with us and share your knowledge, because I think everybody here is really going to sort of go away and think about this and spread it forward and tell everyone they know. So I think that's at least 50 people who know more than they did an hour ago. So thank you so much. I will let you know the links so that you can share it with your colleagues as well when it's up on our YouTube. Thank you very much. I'm going to stop recording now if I can.
Thank you.
Thank you, everyone. Thanks very much.